to take like quick like weekly surveys, and it would give the employees a readout of their mental health over time, just very basic questions. They had on-site resources tailored to this group of workers, frontline workers taking care of other people. And then these apps took like anonymized feedback and gave it to hospital leadership. And so that was something that allowed them to respond on like a weekly basis to the needs of their employees at that time. Do you have enough protective gear? Are you living apart from your family? I mean, a lot of healthcare workers were not living with their families during the pandemic for fear of spreading it to spouses or children. So these were things they were able to take the pulse of their employee base in real time and respond. Another thing that was rolled out really quickly is telehealth and virtual therapy, advanced maybe 10 years in 10 days time at the beginning of the pandemic. And so in the United States, there was a lot of red tape around insurance paying and reimbursing for those types of visits before the pandemic. And then those people, and there has been higher utilization of both virtual visits for medical needs and mental health needs. And so having those resources continue to be available for both your employees and their dependents, because those can be really useful for teenagers and young people as well, to be able to engage in a virtual platform, or maybe you have transportation issues, or I'm a parent and a working parent, so for me to attend a therapy appointment is virtually impossible at this point. I have to do it while there's the napping is happening, or bedtime, or something like that. So having those virtual options continue and be reimbursed and promoted, and have actual trained clinicians on the other end of those calls, not just AI systems responding to words and prompts, I think will be key moving forward. I think all those things should stay in place as we move forward.
Yes, the innovation to virtual care has most certainly accelerated as a result of this pandemic, which has really helped reach so many people across the world in getting that quick access to care. James, I know when we talk about creating a culture of well-being, so many companies say, I have a program, but nobody uses it, or I don't see the engagement I need. And again, you talked a lot about awareness, and you talk about companies really need to make acceptance towards change and really look more at the granular level from within. What are some strategies that you would suggest companies take?
Yeah, absolutely. Thanks, Christine. Awareness and acceptance, they precede change, every time. And I think, we've talked a lot about the types of trainings, the supervisions, etc. we can sort of, roll out, and things that we can do. And I think sometimes it's about coming back to real basics, in the sense of acknowledging what mental health is. I often start trainings that I attend and deliver with how many times I've heard somebody say, I've been diagnosed with mental health. And actually, mental health is a whole phenomena, like physical health, etc. And we've got to think about it on that sort of continuum. And I think fostering an environment that's all about mental health, and not just about mental health when it comes down to things have gone wrong. It's not about how do we fight fires in mental health. It's about how do we support and champion all mental health, even positive mental health. And recently I attended a different training for somebody else in a different sector, and one of the things I saw in the staff room was a positive mental health board. And what they'd done for themselves was to put up recognition of moments where they felt they had very positive mental health, and what they were doing at the time and what made them feel good. And I really enjoyed that, because actually it was something different. You don't see that all the time. So it's about, I think a good strategy is to actually push positive mental health forward. Let's start talking about all mental health. Let's not just talk about mental health when it's about what's gone wrong. And I think that's really, really important, because then we're supporting the whole piece rather than just fighting those fires. And I think supporting employees to talk not just to leadership and management, but to each other as well. I think that's a really big part of this. Support groups that don't include management, or encouraging tea break time if it's in the virtual sort of domain. Setting up a sort of virtual coffee and chats between peers. Why does the line manager need to be there? That sort of thing, and let people have that space, leading the conversation. It doesn't mean leaders being involved in every conversation. And employees can be part of committees, groups, they can be ambassadors of mental health, and roll that out there, give people the choice. Do they want to take that responsibility on, and do they really want to be involved? Because actually what we're finding is that, especially where we are, lots of people want to be involved in different opportunities like that, and so it's almost like a build it and they will they will come sort of thing. So I think it's it's absolutely right to do that, and to roll mental health out there, about the whole piece and not just the negative stuff.
So I love how you said build it and they will come. That's actually quite interesting. I mean, don't you think it takes time? All the things you mentioned to me indicates that this helps organizations be more resilient and build resiliency within their employee population. It takes time, though, to do that, right? It doesn't happen overnight. It's, as you said, it's a continual thing that needs to occur to really build that culture. Would you agree?
Absolutely, yeah. And where the leadership is in that is, coming back to that leading by example thing, and actually, if somebody takes that step forward and talks about maybe their own mental health stories from the front sort of thing, then others will follow. And it will take time, because we're talking about cultural change, organizational change. We're going against the grain of things that that 50 years plus, and actually I think it's really interesting, because there's a whole sort of global investigation going on at the moment, many different countries, the 4-day working week, and that's I'm following that very, very closely, not because I'm particularly an advocate or a champion of the 4-day working week, but because this is about global organizational change. And actually, there's two different sides of the story that are coming in terms of the feedback of this trial. And first of all, I really like that, because it's on the back of listening to employees that this trial is even happening. And second of all, it's interesting to just see the different ways in which the conversation is going. And some companies very keen to lean in and very keen to lead by example, and ready to sort of roll the dice and let's see if this works. And the feedback is yes, it's working. And then others maybe not so keen to take that step, and the feedback is no, it's not working. So actually, I think it's about leaning in, and I think it's about rolling the dice as well, and taking that chance.
Julia, do you see that? I mean, you work with many clients across the globe. Do you see some adapting to this and then others not? And the ones that are they seeing change?
You mean for the
creating the culture of well-being and the different strategies they're implementing? Yes.
Or I thought you were kind of referring to the 4 days a week. I'm just like, that's going to be
that too.
Depends on the original topic. But yes, definitely we see the changes are happening. But I think one of the line that I've been using in many conferences and the discussions, and this is kind of the big statement, right? That the well-being is not HR responsibility, right? It takes a village to promote workplace well-being, and in particular, mental health. So therefore, the well-being conversations needs to be much more than HR conversation. And those companies who indeed moved it outside of the HR domain and made it kind of as a center point of their new culture, new direction, new kind of strategy, we definitely have seen much better and bigger progress and impactful progress in the companies. So based on my experience, I thought I will share a couple of the steps, actually not couple, about 6 steps, what we see, broadly speaking, what our companies are doing to promote the culture of the well-being in their organizations. Number 1, we see that companies are establishing the baseline. What does well-being mean for the employees in their organization? Not understanding what other companies are doing, but what does the well-being means for their companies. Once they establish that, number 2, they're trying to hear what the employees have to say. And we worked with many companies, and it's really sometimes a surprise what you think you know about employees and what they want and how they appreciate your programs that you have been putting together, how in reality it's a very kind of different picture, and what do they really need. It's really interesting to hear what the employee will have to say. Once you have these 2 starting points, I think this is definitely right away a really good plan. Start assessing your current programs, what you have, and constantly communicate that we've heard you. You said you want this. This is what we're planning to do. This is the audit that we are doing, and this is some of the changes that we are planning to implement and introduce. I think it is important, all of us are very different, and we access different benefits differently as well. So therefore, I think it's important to create the multifaceted access to care. It's equally important to continue the target training programs, whether it is for managers, for caregivers, for those people who are managing the diversity group who might have a completely different needs in life outside of work. So I think it's really, really important, to have this targeted training program. But most importantly, or I guess, kind of like something that goes through all of these steps that I mentioned before, is really for leaders, for managers, for employees, because we cannot really take the employees and kind of not to put the responsibility on them. And the responsibility is constantly focused on creating a better place for work. It means design a positive place to work for yourself, for your colleague, for your peers, for your subordinates. It is for leaders, to think about the positive culture, leadership capabilities. There are lots of conversation again about the hybrid working, future of work, skills economy. So what all of this mean for the employers, right? Once you constantly bring a clear point of view, what does it mean for the employees to avoid this kind of gray areas, which is again one of the reasons why many people leave. I think definitely this will give employees kind of a lead way when they're establishing the culture of the well-being.
Thank you, Julia. And I think those are all excellent points, as we talk about, having a well-being program and a culture of well-being and put everything at the forefront. How do people actually access this type of support, especially when we look at times of crises? Madison, I'd like to turn it over to you. When we look at the disruption in the economy, the environment, social and political climates, it's continuing to endanger student well-being, as well as employee well-being, of course. What can institutions do to ensure students have access to emotional support, especially in these times of crises?
So, I mean, there's a few really important things. It's really important to make sure that there are different ways for students to access the support. Not everyone feels comfortable accessing support in exactly one way or the other. There are students who maybe have had bad experiences with counseling, for example, and so maybe they're intimidated to go speak to a counselor face-to-face immediately, or even there doesn't need to have been a bad experience in the past. Maybe it's just an intimidating process. For some students, I know it's easier to approach this this thing that feels so big through something they're more familiar with, like maybe an app or calling or texting, and that's a more manageable thing to just do that. But like Taylor mentioned earlier, it's very important that there's someone trained on the other end instead of an AI responding to keywords. It's very important to make sure that there are these different supports, but make sure they're still supporting people directly.
Thank you. Yes, and I also think too, not making it complicated, like you said, just making it easy for people to connect in. If it's complicated and they feel like they're going into a vacuum, they're going to hang up, or they're not going to continue on with their care. With that, Julia, what do you see companies doing, and how can they ensure that their employees and managers have access to this type of support?
Yeah, I in particular want to kind of draw your attention to a couple of things. And number one is I'm in Asia, right? And like we talk about the stigmatizing mental health globally, but I think in Asia it is even more amplified. So I think whenever global companies are putting different programs in place, including AAP programs, I think companies do need to recognize the local nuances. And the local nuances are that if we want to create an environment where people are comfortable to reach and have an access for the emotional support, we really need to recognize the culture, the language, the local context, because all of these really playing a big role for people either reaching or not reaching for the support that is in place. So we've seen in Asia, a rise of the digital employee assistance program. And I think they are quite successful. And the reason for that is because They are run by the local providers who speak the local languages. All the counselors are coming from the country where you are calling. So if you're calling from Thailand, you're calling from Malaysia, so you will have a local counselor talking to you, understanding where you're coming from, right? With some of the social norms and the cultural norms that may be needed. This is number one. Number two, I think, again, the digital support, obviously, this is like very, very important. And again, we run a survey, and one of the most amazing thing was that we know that telemedicine and access to the digital healthcare is important, but particularly in Asia, we have seen a massive uplift and uptake of the digital mental health support and talking to the counselors and accessing it on much more often base than a regular EAP support. Why? Because there is the whole concept of faith, and people are afraid to be seen by somebody going to a counselor, or like when you need to get the support. So we've seen, that people can take a session at the comfort of their home without leaving home, and this, I think, is really, really important. I don't think it's really important only for Asia, but I think for Asia we just seen, that that support has been taken on much higher rates. And again, I go back to what we just started to talk at the very beginning. Add employer listening as the very first step, in whatever you do. Only that's how you can